some internet issues that I think it is opening, but it's okay, sir. You can see the question in your colleagues. How many of you are having trouble in answering? Please raise your hand. Is it? Oh, means you're opening the question, but you're struggling to answer. It's fine. It's totally fine. How many of you finished already? Yes. How are the question? Is it tough? Okay. I can see a lot of smiling faces. Once you finish the test, you will get the score immediately after submitting the questions. And you can, yeah, it's okay. Are you all done? Shall we proceed? So you can reflect on your answers, and if you have made some errors, it's totally fine. We'll go through all these questions today, and at the end of the day, we'll be having one more simple post-test similar to this, and I hope everybody can score out in that. So with this, let's move into our main agenda. Shall we? Yes. So to do this honor, I now welcome Dr. MBSV Prasad. Sir is a Secretary, Hemophilia Society, VIjayawada chapter, and he will welcome the gathering and introduce you to this program. Sir, over to you.
A very warm welcome to the esteemed chief guest and delegates gathered here today for this significant workshop on hemoglobinopathies and hemophilia. We are honored to have distinguished experts in this field to join us for this important event. I extend my heartfelt gratitude to the chief guest for graciously accepting our invite and taking time to be here with us. Your presence and expertise inspire us all and elevate the importance of this workshop. I would also like to extend a very warm welcome to all the delegates who traveled from near and far to be part of this event. Each one of you is a precious contributor in the field of hemoglobinopathy and hemophilia, and your participation is a testament to your commitment in advancing knowledge and improving the patient care. Your collective wisdom and experience are invaluable assets that will undoubtedly enrich our discussion and pave the way for new breakthroughs. We have carefully curated an agenda that will encompass a wide range of topics. This workshop holds great significance as it provides a platform to exchange insights, share research findings, and discuss latest developments in the treatment of hemoglobinopathies and hemophilia. We have carefully curated an agenda that encompasses a wide range of topics. Therefore, without further ado, I once again extend a warm welcome, and I am sure that your expertise and presence will make this event an exceptional. Thank you very much, sir.
Thank you, sir. Thanks a lot for your wonderful speech. And so we also express our gratitude of conducting this event and giving us also the opportunity to be here with you all. So now I would like to invite on stage Dr. Ranjita. She's from National Health Mission, Andhra Pradesh. So ma'am will just brief out the meeting objectives for today.
Good morning. Good morning, respected JD sir, Dr. Kishore sir, Prasad sir, and all the speakers and all the delegates from different medical colleges. I am Assistant Professor Transfusion Medicine at SMC Vijayawada. Today I am going to brief about the objectives of the meeting. Here we have 13 hemophilia treatment centers in the state of Andhra Pradesh. With this meeting, we would like to strengthen the hemophilia treatment centers and provide training to the treating doctors and paramedical staff regarding the availability of the drugs, factors, consumables in all hemophilia treatment centers, and to adopt new treatment guidelines in treating hemoglobinopathies and hemophilia, to conduct awareness campaigns all over the state for identification and screening of hemoglobinopathies and hemophilia. And further, we would like to identify more treatment centers on PPP mode for better treatment and quality of life for the patients suffering from hemophilia and hemoglobinopathies. Please utilize this session and let us give a better life for the patients. Thank you.
Thanks a lot, madam. Just to list out the meeting objectives. So from here, I think the long-awaited symposiums, so we shall begin it without any further delay. So we'll begin with the Right for Better Life Symposium now. So we all know that hemoglobinopathies and hemophilia, they are one of the leading causes of both adult and child morbidity and mortality in our country. So for this, we will be starting the symposium. And now I would like to request Dr. Kishore, Joint Director for Blood Transfusion Services, to come on stage, and he'll present on a scenario of hemoglobinopathies and hemophilia care in Andhra Pradesh.
Good morning, all. First of all, I'm very thankful to the Dr. Prasad Garu, Dr. Singareddy and his team for conducting this important program in the state of Andhra Pradesh after long back. I'm also thankful to the honorable delegates who participated from all over country for this session, and the participants from all teaching hospitals in our state. Thank you very much all. Now coming to the basic scenario of hemoglobinopathies and hemophilia in the state of Andhra Pradesh. Now presently we are having thalassemia patients of around 2,129 patients are there. And around sickle cell patients are 1,504 patients are there. Now they are all getting treatment. And unfortunately, we are having hemophilia patients of 689 patients are getting treatment in all teaching hospitals, around 13 teaching hospitals. For all these patients, for hemophilia, thalassemia, sickle cell patients, we are giving free medications and also factor treatment in all the teaching hospitals. And I'm also submitting that we are having budget of 15 crores in the last financial year, and this year the budget is increased to 19 crores for all three bleeding disorders, BB disorders. And we also given government is also supporting the free treatment, inpatient and outpatient treatment in RxC scheme for 5 lakhs per year for each family of the BB disorder patients. And also, I'm submitting you all from Government of Andhra Pradesh and from NHM for MEPSAC. For all the patients, we're supplying free blood transfusions in all government and private blood banks from long back, and will continue in future also. And we're also submitting that we are giving 10,000 rupees every month pension to all the thalassemia, sickle cell, and hemophilia patients from last 2 years onwards, and will continue in future also. And especially for thalassemia patients for bone marrow transplantation, and in RxC scheme we are having 10 lakhs for less than 14 years patients, and 11 lakhs for more than 14 years patients. We are giving to the patients for the benefit of better health to the BB disorders. And also last year we established 13 hemophilia treatment centers in all the medical colleges, and we're running successfully, and we're implementing the factory treatment in all the centers. And also last year we established 4 ICH centers, integrated centers for hemophilia and hemopglobinopathies in Paderu, in Vizag, Guntur, Kurnool, and Kakinada, including the old HPLC machine is there in KJH. It is all working. Including that, we have 5 centers for better investigation purpose and screening of the both thalassemia, sickle, and hemophilia patients. I'm very clear from government side, we are committed to give better health services to all the BB disorder patients. And I'm very thankful to all the doctors who came from the very long places to attend the meeting. And we advised the new doctors for get more services in future. And we are very free to contact anyone, any doctor for any issues regarding for better healthcare services in your hospitals, because we identified you are the nodal person in that hospital for hemophilia and thalassemia sickle cell patients. Thank you all. Thank you very much.
Thank you, sir. That was really great listening to you, and it was a wonderful talk. So now I would like to invite Dr. Kishore, then Dr. MBSV Prasad, and Dr. Rajendra Prasad, Center for Disease Control, and Dr. K. Sudhakar, who is the Dean from Siddharth Medical College, here on stage just to light the lamp. Now with this, I would request Dr. Ramana Dandamudi. Sir is a pediatric hematologist from Little Star Hospital, Hyderabad, here to highlight on the basics of hemophilia management and its current challenges faced.
Good morning to all of you, and it is a great moment attending this kind of meetings. You know, these are the whatever the developments and the practices taking to the base level, that is very important. The intention behind the meeting I could see excellent, and I'm very thankful to Dr. Prasad sir and the NHM government of Andhra Pradesh and Navarnad district. Let us start. Yeah. Okay. You know, today I'm going to cover the basics of hemophilia management and challenges. Next slide, please. Yeah, what is exactly hemophilia? We all know it is an inherited blood disorder with the deficiency of factor 8 and factor 9. Next slide, please. Next slide, please. Yeah, we all know the pathophysiology of the bleeding disorders. Basically, whenever there is an injury to the at microvascular level, immediately the platelets come on, and then being strengthened by the secondary hemostasis by forming the clot formation. Whenever there is an issue, next slide, please. Like here, we all know that extrinsic and intrinsic pathways. And the intrinsic pathways, we can see the role of factor 8, factor 9. Yeah, next slide. And next slide. So whenever there is a deficiency of factor 9 and factor 8, the intrinsic pathway grossly affected, therefore the bleeding sets on. That is the problem. Next slide, please. Next slide. Previous slide. So we all know there are issues because we do not have a very good registration methodology. That's where we need to focus to develop these services to impact the people at gross level. And if you look at one of the latest data available from the government of India, the hemophilia A roughly constitutes around 20,000, followed by hemophilia B, 3,000, and von Willebrand disorder, you can see very low numbers. That means, hardly, you would expect the incidence of 1 in 2,500, it should be running into the lakhs, but only 1,000, not more than 1,000 von Willebrand disorders being noted. The other uncommon are like factor 7 deficiency, factor 13, Glanzmann's, and inhibitors patients with the 900, and hemophilia B with inhibitors 19 patients. This is the latest from the 2019 report. Next slide, please. So if you look at the incidence of the hemophilia disorders, particularly A, 1 in 5,000 to 10,000, and B with 1 in 40,000, the number stood at least 1,30,000 to 1,50,000 for our population of 140 crores, whereas only 20,000 patients being registered so far. So there is a huge lack in how to kind of bring these patients from the community to the level of hospital services. That is one of the challenges what we have today. And whereas again the treatment difficulties, because still a lot of these patients, they get blood products like FFP, cryo. Simply it's kind of a lack of awareness among the patients and the doctors. Next slide, please. Next slide. Can I operate? another big problem is once the kind of patients population, and second thing, the ability to diagnose. If we look at what are the advanced facilities available on the private side, hardly 80 to 100 labs are available providing a good services for diagnosing these bleeding disorders. Whereas you taking the medical college as a unit, till now we have 400 to 500 colleges across the India. Hardly 12 have these facilities to diagnose a bleeding disorder. It's a huge gap there. So how we going to improvise, and at least one medical college per district should be able to run through these basic amenities like proper diagnosis of PT, APTT, thrombin time, fibrinogen, and like if possible mixing experiments and the. So we know the issues here is a late diagnosis or misdiagnosis often, because we always come across the patients who are being diagnosed coming to us again and again. But comparatively, the new diagnosis patients are very, very less even today. So we need to work on that, how to kind of bring awareness among the communities or society, and then the doctors, and more effective diagnosis of these disorders are very, very important. Next slide. So we know the problem at various levels and how to handle that. I think this kind of initiation is well appreciated, at least to bring at the top level and take down to the level of the societies and the government, so that this can happen. It's not a difficult one. Next 5 to 10 years, this is going to be the reality. Next slide, please. So this is a typical one of my patients being diagnosed around 4 years with kind of comatose. The family very well known that the child's uncle had a severe hemophilia, and this boy had trivial bleeds but never been major. But a family, though educated, both parents are working, but they never had a kind of a feel that being taken to the investigation. So was unfortunately this patient first presentation itself into a CNS bleed. Next slide, please. This is another patient with multiple bleeds, and you look at the joints in very bad, not very effective management. These are the challenges we were facing for last 15 to 20 years. I think we are looking for a better, at least now we all know that factors freely available. So these things can be kind of can be improved, and a better quality of life can be expected. Next slide, please. So how to start, when you have a patient who never been diagnosed coming to you, the history is very, very important. It is kind of puts you to think how to do the differential diagnosis or investigation. Next slide, please. So establishing symptoms and a lead to the differential. So here I'm going to give you a very important tool, that the history is very, very important before planning the diagnosis. Next slide, please. So a lot of these children will have a repeated bleeds in usual way or unusual way, and whenever being challenged with a trauma or any surgery. So these children should be immediately investigated. And also it's very important to have a family structure, being kind of diagnosed or not diagnosed, having similar problems, very, very important. We cannot mitigate this kind of a history because it stems for a good diagnosis. Next slide, please. So most of these children with the severe or moderate tend to present earlier, whereas mild hemophiliacs tend to manifest later part of the age whenever there is some kind of a challenge. Next slide, please. So how we need to investigate? One is particularly when the kids, even the taking a sample is a challenge, particularly these kind of children's, because at least around 10 to 15% of the children come back to us with a bad venipuncture injury, or sometimes occasionally compartmental syndrome following the bleed at the phlebotomy site. So make sure that you are suspecting a bleeding disorder. Even taking the samples in a right way is very, very important. Once I prefer the children should be taken to the lab, effectively take the samples in the right bottles at right volumes. Otherwise, the reports can be changed and you get a false diagnosis or false reports. So the next level, you have a screening test like PT, APTT, platelet count, thrombin. Then you suspect some abnormality, then you go for more definite tests like mixing experiments and factor 8 and factor 9 assays, depending the information available. And it doesn't stop there, because equally these children need to have a genetic confirmation also that would help for further families. So don't leave it. It's very, very important. Next slide, please. So we all know the hemophilia can be kind of parted into 3 parts: severe, moderate, and mild, depending on the factor levels. If factor level is less than 1%, severe, usually these children or patients can have a spontaneous bleeds most of the time. Whereas moderate 1 to 5%, these children can have a troubles with the trauma or any procedure. Whereas in mild, they can present later part of the life, their factors level 5 to 15%, 25%, and then they can present whenever they're being challenged, like with a big trauma or procedures, then they bleed. So it's very important because it helps you for the management of the bleed also. Next slide, please. Next slide. So what are the common symptoms? The hematidrosis is the most common, particularly spontaneous in severe hemophiliacs, constitute 70 to 80%, followed by musculoskeletal bleeds, and then life-threatening like CNS bleeds or the bleeds into the upper airway or lower airway or gastrointestinal system. Very important. Next slide, please. So hemophilia all about is the price strategy. If the bleeds are small or less intense, you can manage with kind of typically at home with not much difficult. But if they have a kind of considerable bleeds into the muscles or the joints, you need to bring them as early as possible, less than 4 to 6 hours. Very important. A bleed, if being managed less than 6 hours, they don't need the factors longer, and the kind of a recovery will be very quick, and the long-lasting damages are very less. So very important is the effective management as early as possible. And then the appropriate dosing is important. Now the factor availability is not a problem. I think what I found in my practice in last 2 to 3 years, all the children actually nicely getting actually more than what they require. So it's kind of the problems with the vial strength or kind of the understanding. So but that is happening. That's very good. But the only thing still I find is there is a definite lag between the bleed and taking the factor, that we need to work it out with the family. Next slide, please. So if you look at the factors, we all know that the kind of as being said initially, we started with blood products like whole blood and components. And then we got the plasma-derived factors. Now the recombinant, and things are moving. But still, if you look at the percentage of the patients and the total quantity of the factor get in India is comparatively with the Western countries very, very small. Hardly 2.81% of the total world's quantity we consume, whereas we have 10 to 15% of the world population patients. So there is a huge gap there, at least around kind of 80%. So how to improvise, that's very, very important. Next slide, please. So again, another thing is usage of the factor always in India like countries depends on the pricing of the factor. If you look at it, so here, when the price is there, 35 rupees per unit, the usage is very little. Whereas the price, when it's coming down, like there, 10 rupees, the usage is suddenly has gone up. Either that's relevant to the private practices or even for government, because government effectively can give, make it available in all the centers in sufficient quantities. So certainly it does work for the economics. Next slide, please. So we all know the evolution is moving very fast, though we thought nothing happening, but only the problem comes about the costs. So automatically, whenever the pricing of a product is very high, the ability of to store it or get it will be difficult. But however, what we're trying to convince the family, if we look at a typically a group hemophilia patients 20 years ago, majority of them, 80% to 90% of them are very crippled. Whereas compared to today, young children, they don't have the same problem because the price of the factor is low, the number of variety of factors are different available. Now patient can walk in even into the government institution, can get the most expensive drug like Hemlibra, just like that, provided if they got indications. That wasn't possible before. Not getting even average ordinary factor also was very difficult. So these things are changing, and we need to convince the family the early treatment, because in future, what I could see in 5 to 10 years time, there will be more developments, better drugs can be given once in 15 days or once in 30 days, nicely at home. Only thing is the price, but that's not going to hamper us to give the best for these children. So this will happen. We need to convince the family and kind of engross them to have a good family counseling, not only for that affected patient, also looking at the family to have any other affected patients or carriers. So it's very, very important strategy in counseling the family. Next slide, please. So how we manage? Typically, all these children need to be diagnosed. Once they're being diagnosed, they should carry a good detailed information in a precise way about in a card manner that often can be kind of taken a responsibility by local chapters of Hemophilia Federation of India, or even the kind of we can work it out through the government, some kind of come into the rise or price strategy. With the simple bleeds, you can effectively